We take a lot of things for granted. Going to a dental office, for instance, to have our teeth cleaned may take us 15 or 20 minutes. Or maybe having a tooth pulled or having a cavity filled, and that takes about 30 minutes. But special needs people don't have those services available because it takes a long time to solve some of those problems and to serve some of those people. This is Faces and Places, and I'm Larry Berg. There's an organization that just formed called Accessible Dental Services, and there's a mobile program available just in the last couple of months to deal with special needs patients. Karen Noah is the Director of Operations, and Karen, it looks like you're solving a problem that many people never even knew existed.
Well, the problem has existed for years. Accessible Dental is part of Passavant Memorial Homes, and Passavant Memorial Homes had the problem faced by many of not having any place to send our special needs individuals to the dentist. So we formed a team together. Our president and CEO, Rick Senft, has always been committed to providing quality care and enriching the lives of others. And he, along with Patrick D'Amico, our vice president and COO, teamed up with professionals, one being Dr. David Pavasco, who's our dental director, to form Accessible Dental Services. And we just provide dental services to individuals with special needs.
Now, what is the problem? Why is it so difficult, or what's so different about serving that population?
There's a couple different problems. One of the main problems is that very few dentists are trained in working with this population. So because of the fear of working with them and also the insurances that they have, a lot of the dentists won't accept certain insurances that many special needs patients have. And they're very difficult to work on. A lot of them have behavioral issues and very medically involved that it really takes a special dentist. And we also have an anesthesiologist on board as well who can treat this population.
Karen, does it take longer to treat this population than it would other people?
Yes, it takes a lot longer. Maybe a routine cleaning for you would take 20 minutes. For them, it can take up to an hour, just because you have to keep reminding them to open their mouths. They could be scared, so it takes a lot of coaxing and talking them into opening their mouths and getting the service done.
Are dentists generally capable or trained to do that kind of a service?
No, we have found that only 2% of dentists in Western Pennsylvania are trained in working with special needs. So with that, we have formed a partnership program with the Pitt Dental School, and they will be sending their 3rd and 4th year dental students to visit one of our fixed sites to do an internship with us.
Now, we hear the term special needs children or special needs adults. Just what is the problem with these folks? What do they have that other people don't have?
They're actually another term that's commonly used is IDD. They're intellectually and developmental disabled people in our society. And they have, a lot of them are they have a diagnosis, some of them as mental retardation, and a lot of them have very serious physical handicaps as well.
Now, you've been serving these people for some time in 4 offices around Western Pennsylvania, but now there's right behind us, there's a mobile unit. That's just new, isn't it?
Yeah, that's just new. It was actually delivered in June. Our goal for the mobile dental unit is to take it to far outlying counties. We have people at this time that are driving to one of our fixed sites up to 3 hours to get dental care because there's just nowhere for this population to go.
Where are those fixed sites now?
Our fixed sites are in Rochester, Pennsylvania, in Beaver County, in Murraysville, in Greentree, and in Uniontown.
How many people do you serve?
This year alone, we've served over 900 people.
Now, there are a lot more out there that maybe don't even know about these services. How do you get the word out?
We can be looked up on our website, accessibledental.org, and we also have supports coordination units that promote us a lot to the individuals that they serve, and a lot of it's been word of mouth.
Now, a dental office has lots of equipment and lots of space. Obviously, a unit like this, as large as it is not like an inside dental office. Just what are the facilities here?
On the mobile unit, we have 2 full operatories. We will be able to do anesthesia if needed on the mobile unit. It was designed that the operatories are a little bit larger because we went with the model that you could have had 3 operatories. We went with 2 to allow more room for wheelchairs, etc.
We're going to talk some more with some other people involved with this, including the dental director and others. And let's get some more detail. We'll go inside and take a look at the unit as well so people get a better understanding of what we have here, Karen.
Okay. Thank you, Larry.
What is it like to have to worry about the dental problems of a sister who is a special needs person? Marianne Adams has a sister that she's been working with for a long time. Her sister is 52 years old, 55 years old. And what's her condition?
She has Down syndrome, a more severe level of Down syndrome. She cannot live independently or take care of herself. So that's what I do.
Now, I understand for a long time there was no way to have any dental care at all in your family, that you couldn't find anybody to help you.
It was really difficult. I did take her to traditional dentists, tried to get her care, but within the first few minutes of being there, the dentist would usually tell us to leave because she would be, well, most people are scared of the dentist to begin with. And to be scared and special needs just compounds it. They'd put, their fingers in her mouth, which you have to do. She would gag on it, choke. She would bite down. She would, and before you know it, it's like, just leave. I can't deal with her.
Well, now, obviously, without dental care, there are other problems that can develop. I understand it's pretty dangerous not to have your teeth taken care of. Did you see any signs of any illnesses because of that?
Remarkably, no, not with my sister. Her teeth were bad, when she did get to accessible dentistry, and she did have some gingivitis. They did have to remove a couple of teeth, but remarkably, I think she did very well for not having had a dentist all those years.
So, Marianne, you went to dentists and then you were refused dental care because it was so difficult for the dentist to understand how to work with this kind of a situation. How did you finally learn about this organization?
I was at work one day and I was just frustrated with what can I do? What can I do for my sister? And I got on Google. And I Googled in special needs dentist, Pittsburgh, and accessible dentistry came up. And I thought, oh my God, what is this? And I clicked into the website to read more. And then I called and I explained my situation with my sister. And they said, yes, we can, yes, we can, yes, we can. I'm like, sign us up, and we got an appointment right away. And it was wonderful. Just, I couldn't get over it.
Was this kind of care covered by insurance of any kind?
Well, my sister is under Medicare for her condition regardless, so Medicare had taken care of it, which accessible dentistry did all the paperwork for that. I didn't have to do a thing other than sit in the waiting room and enjoy some coffee and donuts.
And as we've heard, it's difficult sometimes financially for dentists to deal with this problem because it takes longer to deal with a special needs patient, and time is money. And obviously, they're not anxious to give up all that time for the same amount of money they could do for half the time.
True. And a lot of, my sister in particular needed anesthesia. She needed to be put out completely for them to do the work on her. So you're adding those costs in as well as the recovery time and everything else that's involved with being put under.
So you found a solution to your problem?
Oh, my God. Yeah. Honest to God, I never thought it would ever happen because it's been years that I've been looking and trying. And like I told Karen, they're a godsend. They're a godsend.
Marianne, thank you very much. Marianne Adams, the sister of a special needs patient who was being taken care of by this very special dental program.
Yes.
And now we're inside the mobile dental clinic, the one you saw outside just a while ago. Dr. David Pavasco is the dental director. And doctor, I know this is a brand new operation. This unit has not been on the road yet, has it?
No, it has not. We just finished fundraising for it a few months ago and just had it custom designed. And our goal was eventually to take it out sometime this year or early next year.
Is this outfitted pretty much like an office would be, like your dental office would be?
Yes, that's correct. It's a fully functional mobile dental unit. Same things that I have in my office in Murraysville, we have here, so we're capable of doing any dental treatment on this mobile unit.
Now let's talk about the facilities in here. This is very much like a dental office in many, many ways. What kind of equipment do you have? and what kind of equipment is necessary for the kind of work that you do.
Yeah, well, what our goal is with this in treating special needs patients is trying to get to their facility. Sometimes it's very difficult for them to travel, and we're concerned about if they are sedated, traveling back to their facility for an hour or 2 hours. Some of them will come 2-3 hours to our clinics. So we purchased this mobile unit. It's fully equipped, 2 dental chairs. There's a dental chair in the front and a dental chair in the back. Basically like a full dental office. It also has a wheelchair lift. So what our goal is to drive right up to the facility. The patients will be in their facility. The wheelchair lift will come down. They can, wheelchair right in there. We'll bring them up, get them in the chair, perform the dental treatment necessary. If no sedation is needed, we'll perform it. If sedation is needed, we'll have an anesthesiologist on board with us to provide the sedation. When the treatment's complete, the patient can go right down the chairlift into their, into their own room and facility and recover there. So if there is any medical problems at that time, we'll be right there to deal with them.
The one thing you didn't mention is X-ray machine. Do you have something like that on board?
Yes. Yeah, we're going into we have an X-ray machine, and we pretty much state of the art here. We're using digital X-rays also. So we have a computer system in here that the X-rays. Some dental offices are doing this, some aren't. Where instead of using the typical dental films, we have a digital system now where the X-rays will come right up on the computer screen almost instantaneously. So there's no waiting. Again, while a patient's sedated, you want to devote as much time to treatment as possible rather than not treating while you're waiting for X-rays to get developed. So we've tried to outfit this, as best as possible at this point to treat the patients in a caring manner, but not have them sedated in a long period of time.
With the special needs people that you're dealing with, I think first of all we ought to define that a little bit. Just what are their needs?
Yeah, our patients, clients that we see with special needs, typically they have Down syndrome, cerebral palsy, autism. We work with all different types of special needs where they're apprehensive to be seen in a dental chair. It takes a little more time. They move a little slower. The caretakers are with them, and they're a little apprehensive of the dentist. Just like a normal population would be apprehensive. They're a little more so. So we have to spend more time, talking to them, getting their reassurance that what we're doing isn't going to hurt them, and letting us treat them.
Well, doctor, some of the patients I would imagine have not been treated for a long time, and in some cases I would imagine not at all. What kind of problems do you see with their teeth when they come in after very little or no dental care before this?
Yeah, we do encounter that a lot, where the teeth are so bad from bone loss, we do have to do extractions. There's a lot of periodontal gum disease problems in this population because it's very difficult to maintain their teeth. Their caretakers do the best they can, but sometimes the patients are a little combative or resist dental treatment. So it is very challenging for the dentist. You're looking in a mouth the first time, and sometimes you don't know which direction to go. You want to try to maintain the teeth and maintain the best we can. So we work, together with the caretakers, the family, in trying to do what we can as the dentist to get their mouth in good shape, and then we tell them how we want them to maintain it for us and continue with preventive care.
Well, let's talk about the patients who are underserved and have been these special needs patients. What can the caregivers do that maybe they don't know now to take care of their teeth themselves even before coming into the clinic?
Well, what we try to stress, is I think the population's been, so underserved that we're trying to set up, through the University of Pittsburgh, through organizations like Accessible Dental Services, kind of a home base for the dentists. We're trying to outreach to many dentists in the area so that they'll be the initial, for lack of a better term, like a triage dentist. They'll get the patient in the chair and see what they can and can't do. If the patient with special needs just needs a routine cleaning, a little gum cleaning, and they're cooperative, they can do that treatment in the office. We want to start educating dentists that if more treatment is needed, that the patient needs to be sedated, various types of light general sedation, heavy IV sedation. They would refer to clinics like the University of Pittsburgh or Accessible Dental Services, where we have anesthesiologists that can perform those services.
But I want to talk about the caregiver at home that may not even come here. They're just watching this program today, and they realize that they're caring for a person that does not have dental care at all or very infrequently in their lives. What should they do at home to do the best they can at home before coming in to see a dentist?
Well, the best they can do is try to get, toothbrushes. There's little swabettes you can use, wiping the mouth with gauze, mouth rinses. There's a lot of fluoride rinses, over the market that you can use nowadays. I would stress it would probably be, the most important thing would maybe get them into the dental office and see what they need, and then the individual dentist can guide them from there on the various preventive measures.
Now, doctor, when you went to dental school some years ago, you probably weren't taught how to deal with this population. How did you learn how to do it?
Just trial and error, basically. Yeah, we didn't. I graduated from University of Pittsburgh, and there wasn't a formal program with special needs. I think they're starting to do that a little bit now. But you did run into some patients with special needs, and you learned a little bit. And as my practice has evolved, we saw one patient, and then one turned into two, turned into four, and we kind of evolve just like anything. As you work with it, you learn various ways to calm the patient down. You have to spend a little more time. Have some of the caretakers are in the room with us while we treat the patients because they're more comfortable. We want to set a comfortable atmosphere. The more we see the patients, we've noticed too that they feel more comfortable. Their first visit, they're very apprehensive to get in the chair. When we see them again, if they needed a routine restoration or a 6-month cleaning, they come in and they're more happy. The same faces also help out a little bit. My staff, fortunately, has been the same for the last few years, so they recognize these patients, and we try to befriend them.
But doctor, there must be some economic considerations too. If it takes so much longer to deal with a special needs patient, what's the incentive for a dentist to do this and provide and spend more time with the same compensation with a patient when they can stay with other patients and make a little bit more money?
Yeah, that's an individual decision a dentist would have to make on his own. Yes, if you're going to see a whole day worth of special needs patients, you probably would lose a good bit of income. But if you kind of, one day you might want to see two once a week or something like that. It's doing a little bit of charity work, but I don't think it would impact them financially if you're looking at, setting a small goal as a dentist to see, let's try seeing just 2 special needs patients this month. That's not going to affect your business that much. I do give you that if that's all you're going to devote your practice to, yes, it might be less financially rewarding, but more inner rewards for you, I think. That just taking care of the people, that's part of what we're taught to do in dental school.
So it will take many, many more dentists then to provide all the services necessary. If each one only does a few, are more dentists becoming interested as years go on?
Yeah, I believe so. Right now, like accessible, the University of Pittsburgh has started a special needs clinic, very, very modern clinic, and they're starting to educate their students as they come out of school about dealing with patients with special needs. There's clinics like Accessible Dental. There's a clinic I'm aware of in Philadelphia called Special Smiles that are treating patients with special needs. And I think the general dental community is getting aware of this problem and is trying to reach out to them.
Dr. David Favasco, he's the dental director here at the Mobile Dental Clinic, and we'll be talking with someone from the University of Pittsburgh to find out how they're training dentists to be more sensitive to this population, the special needs population. We've heard about how the special needs patients are being treated with dental problems, but we wonder sometimes, where are the dentists coming from, and how are the dentists being trained, or are they being trained to handle this kind of a population? Dr. Richard Rubin with us. He is with the University of Pittsburgh School of Dental Medicine. And Dr. Rubin, are dentists being encouraged to be able to deal with these kinds of patients?
Well, absolutely they are. And in fact, at the University of Pittsburgh, we now have a new independent center for treating special needs populations. And this is fairly brand new. It's the first in the country that really is set up where we can take patients from different areas, say from pediatric areas, areas of some special clinics at our place, and geriatric clinics and things like that, and actually combine them to all come to this one center to learn. And of course, students have rotations through those through the center itself.
I really wonder, though, what the incentive would be, because it takes so much longer to deal with a special needs dental patient, and time is money, as we've been saying during this program and other places. And how do you convince a dentist to provide more time for the same amount of reimbursement?
Well, what we're trying to do at the school is to make this really a holistic new approach to dentistry, where we are really trying to look at these populations just as part of what dentistry is all about. And we're trying to make it so that within the course of what they see in their offices, that they're not afraid when people call them to see a patient with disabilities, see what they can do with them. Close to 80% of special needs populations really could be seen by a general dentist, but there is the factor of the unknown that they have to deal with, and the factor, sure, they do have to set up their clinics and such like for it, but they haven't really had as much opportunity in the schools before to really learn about ways to handle these patients, ways to communicate to the patients, and now we're trying to provide student education to be more in tune with that.
So it seems to me that what you're saying is that technically any dentist can handle any dental problem, but here there's a communication problem because these are special needs people, many times with physical and mental disabilities, and that's something that not every professional might be able to do.
Well, that's true, and that's where programs such as the one I'm dealing with, and again at the new clinic that's open now, we're trying to teach that new language to the students that are there, trying to, for example, a lot of times you have to really have a preliminary visit by the patient at the office, and you have to make time for them to come in. Sometimes you're just sitting a patient down in the chair, letting them ride up and down in the chair, things of that nature, and getting them accustomed to coming. And then hopefully, of course, there are always going to be patients that they won't be able to see, and that's where places like Accessible Dental Services come into play, where you have to give them general anesthesia, and of course that usually takes special training. But for the general dentist, they would be able to, communicate with the family, which is always a very key part. So they have to learn to communicate with the family, with the patient, and then hopefully they can get around some of the problems that exist so that as part of, not that they're going to see special needs patients all day, but within a period of a week, if somebody called them or a couple people called them, they would be able to say, sure, I have this time, come on in, and we'll see what we can do for them.
Now, Dr. Rubin, communication is very important, as you say, especially with this special population, and it takes a certain amount of compassion. Now, do you screen students who want to enter dental school to find out whether they have that kind of a personality that would lead to a successful venture?
Yes, what we're trying to do now at the school is when we interview patients, we of course look at their background and their history of what kind of services they have been involved with. Usually, for example, if they've dealt with underserved communities and if they volunteered their time and what they've gotten out of their experience, it all comes out in the interview process and all comes out when you read their special, usually a paragraph or two about what they have done over the last few years. And then hopefully it's a hard process to do that way, and you can't always be right, but you try. And so hopefully out of a group of 80 new students, you'll get a real good number of students that would be interested in that.
Because students, dental students, as with medical students or anyone going to these special technical schools, come out with a lot of debt. They have student loans in the thousands or sometimes up to $100,000. Is there some incentive for a student to get involved with this special needs?
Yes, there is. Actually, well, with underserved communities in general, part of the program that I run there, which is called SCOPE, Student Community Outreach Program and Education, and they go all throughout Western Pennsylvania to underserved communities and to what are called federally qualified health centers who treat underserved communities, and they have what's called a loan repayment program. So when students come out of school, if they're hired by these centers, they actually get part of their loans paid off at the same time getting a salary for the work that they're performing. And these are usually highly competitive, pretty good salaries, and so it's a matter of getting the word out to the students that these things exist and that they should take advantage of them.
You find the program's working, that there are people being interested in doing this kind of work after graduating from dental school?
Yes, absolutely. What I know personally from the past few classes that have graduated, some of the individuals in the classes have ended up in places like Erie, places like Conneautville, Altoona. So there's been a good variety of areas that have been covered by this.
Now, dental school is a 4-year program, I understand. How much of that time is taken convincing students or showing students that these kind of opportunities are available?
Well, what's happening at the school right now is we are really changing the curriculum at the school so that we can provide more time for the students to participate, especially in underserved and especially in special needs populations.
Dr. Rubin, thanks very much.
You're welcome. Thank you.
Interesting. Dr. Richard Rubin, University of Pittsburgh School of Dental Medicine. And we're talking about the Accessible Dental Services, a program that's available in 4 locations in western Pennsylvania. They now have a mobile dental clinic that'll be going on the road before too long to provide access to those special needs children and adults for dental care that they have not had available to them before. This is Faces and Places. I'm Larry Berg.